Take it from here. Yeah.
So hello everyone. I don't think I know most of you. I think some of you we've met before. Maybe? No? Yes. Alright. We'll figure this out right away. So to start off with, my name is Michael Van Manen. I'm a physician in newborn intensive care. I work across the street on the 3rd floor. Come visit me anytime. So as a physician in newborn intensive care, I get to take care of babies. One of the most wonderful jobs in the world. And the babies who tend to require hospital care are ones who are either born preterm, they're born with some kind of developmental differences, like congenital heart disease or surgical conditions. Or honestly, they've had a rough start to life, right? They get trapped, birth asphyxia, and so forth. As a healthcare provider, we're using medical technologies every single day. Very much, you could say, our clinical practice is steeped in medical technologies. Both everyday technologies, like the monitors that we use, the laptops to write our notes on the electronic medical record, to very invasive technologies, right? Different kinds of breathing machine supports, different kinds of surgeries, ECMO, newborn peritoneal dialysis. And then at times we also use medical interventions, not quite sure what the effect is going to be, meaning there's limited literature of it, but we're doing everything we can for a situation. So we think a lot about what technologies can do, but we also think a lot about how they change things, how they shape our interactions with babies and with families. So there's a natural connection between the clinical work that I do and health ethics, right? Because ethics, as we're going to talk about today, is really concerned with questions such as, how do technologies change things? Not just what can it do, but is how it's changing things a good thing or a bad thing? So knowing all that, in addition to my background as a healthcare provider, I direct the Health Ethics Center here on campus. You folks are all more than welcome to attend any of the sessions that we offer. I'll put the link in the slides that I'll send out to you after. We do sessions on most Thursdays, usually over lunch. Cover everything from informed consent to MAID to disability ethics. In addition to that, I maintain a research program, which is generally in qualitative methods, and often in topics that relate to critical care, ethics, medical technology. I'm not actually someone who likes to hear myself talk. I chose neonatology because my patients, they generally don't talk. Right? They're babies. We talk in quiet voices, which I quite like. So if I'm mumbling at any point, it's fine to just say, Michael, speak up. And this is also supposed to be interactive. So when you talk about ethics, it's not really that helpful to just sit and listen to someone talk for an hour and a half. It's better to have discussions. And that comes to what you guys all gave your consent for, which wasn't a real consent because, let's be honest, you didn't really know what you were consenting to, which, consent's supposed to be informed. There's supposed to be disclosure information. So what are we asking? Oh my goodness, is this for next year? It is, good. Okay. So in the effort of supporting discussion and dialogue around what is health ethics and how is health ethics helpful in our current age when we're, contemplating different technologies and we're constantly bringing them into play. What I was hoping you could all do is sometime between now and Tuesday, prepare a very short presentation. Okay. I'm not wanting you to spend hours on this, right? Everyone here has busy lives. We didn't give you advance to know that this is something you'd be doing this weekend. I would think, maybe spend half an hour on one day and maybe half an hour on another day. And the reason I say to break it up is because often you'll write something down or you prepare something and you sleep on it, and then the next day you're like, oh, I should mention that, or that's a different way of looking at it. So sometimes a little bit of time is helpful. But yeah, spend no more than a total hour, use a stopwatch, it's a rule, right? And prepare a short 6-minute presentation on a technology, right? A technology that you think is important to look at for how healthcare is offered right now, or how it's going to be offered in the future. If you don't want to focus on health, because maybe you're not a healthcare provider, or maybe that's not your home discipline, and you want to focus on something else, that's fine too. What's most interesting to me, and I'm sure to Kim as well, is that it's something you're interested in or you're passionate about. I'll put this slide up at the end, but what we're hoping you can do in this 6-minute presentation is tell us a bit about this technology. What does it do? How does it change things? Maybe it's a technology that's still theoretical, or maybe it's something that's just being put into practice right now. Okay? Perhaps it's something that's in the media a lot, like AI, for example. Right? Just on my way here, the reason I was almost late, no joke, a colleague stopped me in the hallway saying, I want to do a project on AI and ethics. You know, has it been done before? And I'm like, there's so much coming out right now on AI and ethics. Like, it's really hard to come up with projects because we've lost track of how many different projects are underway, right? But, you know, take for example, the technology he was talking to me about was AI use in predicting bad outcomes, right? So when we take AI and we train it, and we say, look at the charts of all of these babies. Here's this outcome that we're worried about for some of them. Maybe it's death in the long term. Maybe it's, you know, long hospital stays. Maybe it's something else, right? Can you help identify other babies who are at higher risk of that outcome? We don't care how you do it. Just come up with a way of alerting to us in real time that this patient is now someone who's at higher risk. What does that mean? How does that change things, right? If the babies are taken care of on the daily basis, now suddenly get an alert on their chart that says this baby's at high risk of one of these outcomes. When we don't know why they're being flagged as a risk, because it's a complex, you know, algorithm prediction taking multiple factors into play, some of which we might not like. So, tell me about a technology. If you have the opportunity to design it or think about its redesign, what principles should inform its design, right? Like, should we know what variables are being taken into account? If race or gender are being taken into account in a prediction model, is that okay? What are intended and unintended consequences of its use, right? So how will it change the way that people, you know, look at a baby once they say, you know, there's a risk here? What virtues, qualities, or values should the technology reflect? What relationships or narratives does it afford? And if it's something new, how does this technology resemble maybe past technologies? Because that's often a way of saying, you know, what can we learn from our past experiences? So that's what we were asking you to consent to. We'll go through the presentation, and hopefully at the end you can still feel the same, that you're okay doing. I would suggest that if for some reason, you know, this weekend is just, it's bad, there's tons of stuff going on, there's other personal things, just like Kim or myself, no, that's fine.
Yeah.
This is also not meant to be a graded assignment, right, at all. It's more meant to support discussion. In the same way if we were to say, all right, everyone break into a group of 2 and talk between yourselves, and then we'll come back and talk about this case. It's just we're doing it outside of class over an hour of people's time. Any questions about that to start? You see how far I'm holding my coffee cup away from my laptop right now? Don't want it to spill. Yeah. So these are questions I'd like to start off just by asking. When people use this word ethics, what does it mean? Like, we hear it all the time. In fact, sometimes we hear political leaders or other leaders simply say they don't like something, so it's unethical. But what does it mean when something is qualified as unethical? What do you see as significant ethical questions for the future of medicine? How do the ethics of technology relate to the ethics of medicine? So can we speak to medicine itself or other healthcare disciplines having ethics to them? If you see yourself as a healthcare provider, do we anticipate that the qualities that exemplify what makes a good nurse or a good physician or social worker or other healthcare provider are going to change over time in response to different technologies? And ultimately, what is the role of ethics in clinical practice, knowing that it's always touched by technology? So while you're thinking of that, I want to go back one step because I forgot to do something extremely important. I told you about me, but I didn't ask about you. So can we really quickly just go around the room, tell me a little bit about yourself, what brings you here, and guess what? I think you're on camera.
You want me to start?
Isn't it funny how you look at someone, then immediately they're like, oh, you're going to start. There's that obligation.
It's okay, no, of course. My name is Janine. I'm in my last year of my undergraduate studies. I'm taking biological sciences. My major is biology and my minor is psychology. And the reason why I'm in this class is I'm hoping to pursue a career in medicine. And I knew nothing about technology, and I still feel like I don't know much, but I thought that that would be a very intriguing class to take as well. So yes.
Nice to meet
Yeah.
you. All right, who's next?
Okay.
Perfect. Not at the end, but right in the middle.
I'm Barbara. I'm a PhD student in biomedical engineering. I have both a bachelor and a master's degree in biomedical engineering. But my master was more centered in bio-nanotechnologies, and both my supervisor and a friend of mine suggested to take this course, and I think it would have been fun to be part of this group. So, yeah.
It's nice to meet you.
I'm Don, and currently I'm doing my Masters of Medicine, and I'm from Sri Lanka, and I was a physician back home, and I won a scholarship and I moved here. Currently I'm working with stroke patients who are having a risk of developing deep vein thrombosis. So we are dealing with a new technology to use as a prophylactic device. So these days I'm doing that.
Nice.
This is my last course in the my program.
Oh, almost done.
Almost done.
I hate to tell you this, but it never ends. The learning.
Yeah.
It's like my last course. No, it's not.
My name is Zoe. I'm also in my last year of my undergrad. I'm studying immunology. And last year I was involved in a research project that kind of trained prediction models for cancer outcomes. And so I thought this class was very on topic, and I kind of wanted to continue learning a little bit more about how technology and AI plays a role in medicine.
Perfect. It's nice to meet you as well.
Thank you.
So what do I have next here? Oh, so as we're thinking about these questions, how small is that? Oh, that's so small. I think I can read pretty small. Okay. So I'm going to read a couple of anecdotes just to set the tone, because I always think that when you start talking about ethics, it's easy to get abstract. But it's also important to like bring things back to practice. Okay. So I told you already that I work in newborn intensive care, so I get to take care of babies. NICU is very unique because as a discipline, our patient, who we're responsible to, has never been able to articulate what their values or beliefs are. We don't really know what life is like for them. I mean, we've all been babies, right? But if you were to try and think back to it, well, clearly you don't remember, right? And even if you could think back to it, it may very well be that you're a different person now than when you were an infant, as a consequence of development, and as a consequence of experience. So we're in this strange situation where we're taking care of someone who is different than us, who's other than us, who we're caring for, but also we're constantly wondering what life is like with them. So, a premature baby flays the nice light. A sheet cast over the housing mutes ambient light, just as the plastic structure itself attenuates sound. Only traces of the outside world seem to be allowed in. Within, rolled towels support the baby's body in a position of flexion. His arms, trunk, and legs shift in subtle jitters before settling in stillness. The eyes gaze, yet seem to lack a point of fixation. What is life like for this child? What experiences of sight, touch, and smell exist for him? So I would begin by saying that these are ethical questions. So what is ethics? In the adjacent spot, a newborn is sedated and paralyzed as we struggle to maintain oxygenation. The baby lays splayed with only the chest moving, vibrating in response to the airflow of the oscillation machine. As we're talking, the baby's heart rate rises. With muscles relaxed, she cannot move, let alone open her eyes. Does she experience isolation, or loneliness, pain, or discomfort? What words are appropriate to describe her existence? Again, these are ethical questions. They aren't questions asking, what ought I to do? They're questions orienting to someone or someone else that we can't fully extend. And just so you don't have a negative view of the NICU, tucked in the end of the row, a baby seems almost too well to be in intensive care. A nurse brings a soother towards his mouth. He puckers his lower lip and rolls his tongue. Stroking the soother against the corner of his mouth, the nurse pauses for a brief moment. His eyes are fixed firmly on her. Taking the soothe in, he gives it a few short sucks before letting it fall off to the side. How does a baby experience a world of others? How does he experience a world of things? So, for the most part, these are everyday observations from the NICU. They're moments that we witness as physicians, as nurses, occupational therapists, and also as families, as the parents of these babies. But if we stop to dwell on these moments, the images, the descriptions, and we go beyond the words of, oh, is he such a cute baby? We can find ourselves stirred and wondering for a different reason. If we're wondering, what is life like for these children? How ought we to care for them? Not just for them to survive and go home, but also so their time with us in the NICU is a good time, whatever that means. Knowing that some babies, like the one pictured in the middle, may never go home. So I come from the newborn world, but before I was a neonatologist, I worked in pediatrics, because neonatology is a specialty of pediatrics. And in many ways, pediatrics is more challenging as a broader field, and also less challenging, right? Because you start being able to talk to your patients. But of course, not all kids speak, or some only speak with time. Some have different kinds of genetic conditions. And increasingly we find that many children live a very different life than maybe we had ourselves. So children have what we term medical complexity or technological dependency, which means they may go home, like this little darling in the bottom left, with a tracheostomy and a breathing machine. They may go home with a feeding tube or oxygen, like these two babies here. They may go home with an insulin pump, right, as an adolescent. And all of these different technologies can shape or change things. And I would therefore suggest that they all relate in some way to ethics. So, we need to clarify, what is ethics? It's funny, when I went into sorry, I'm just making sure I don't ramble on and talk for way too long. When I went into medicine, I was interested in ethics right away. But then as I got into it, I was like, I don't actually know what is ethics, right? Like when you go to a talk and it's being advertised as an ethics talk, it usually seems to involve some kind of emotions. Right? Like people tend to be either really passionate about something being really a good thing, or really upset that it's a bad thing. Right? It seems to relate to something being good or something bad. So we could say ethics in many ways deals with normative questions, like what ought I to do? But the questions I asked to open this talk are not necessarily normative, right? In the sense that they're not asking what I should do, but they're still oriented to something else. Right? We could say that the questions that I asked to begin with are other regarding. So we could say that ethics is founded in a concern for whom or what is other to ourselves. And there's many continental philosophers who would take this perspective. The French philosopher LABMP, the Danish philosopher Logström, for example, Bernard Waldenfels. And so there's different people who would say that, you know, ethics as almost a first philosophy comes from this way of questioning. And what is other to us? Well, that could be our spouse, a friend, a child. Right? We deal with ethical situations when our actions somehow affect someone other than me. If it's just me, it's not really an ethical decision. Right? I joke with my kids, if you want to have dessert, it's not really an ethical question, right? Like, because there's lots of ice cream there. But if there's only enough for one, and it means that one kid's going to get it and the other doesn't, then it becomes ethical, because now suddenly your behavior affects someone other than you. And this thing, this entity that's other to ourselves, it could be someone else, but it could be something, right? So we can talk about animal ethics. We can also talk about environmental ethics, where this other is, you know, this world that we live in. It's because we have concern for how we impact the other, which is the world. Does that all make sense? Okay. The other thing that I'll say about ethics is it deals with a particular kind of knowledge, a particular kind of understanding, which is something different than you'll find elsewhere. Right? So there's some knowledge that we can kind of prove, what we would say a priori. By definition, it's true. So we can all agree that, you know, we're going to use the base system for counting, and 1 + 1 by definition is true. It's true a priori, by definition. On the other hand, there's some knowledge that we can only prove after the fact, a posteriori. Right? It's cold outside. All right, let's all go outside and check, and we'll see if we agree. But when you're dealing with questions about something or someone that's other than us, when you're dealing with questions of good and bad, you can't necessarily always reason your way through. You can't reduce them to so-called calculation. So you could say that ethics exists as a discipline precisely because there are these questions which you cannot answer a posteriori or a priori. But they are questions that concern us nonetheless. If we didn't have those questions, we wouldn't have ethics. Does that make sense? Kind of trying to do ethics 101. So we talked about other regarding. We talked about this notion of beyond logic. We've talked about normative questions. And the last thing I'll put here is value and meaning. Right? So I'll position myself. You know, I grew up a couple blocks from here in Windsor Park. Super privileged childhood, okay? My dad was a university prof, my mom was a teacher, they're educators. I swear, like, their focus was on us. Like, it's not that we were spoiled, it's just more that when they made decisions like, where should we go on vacation, it wasn't what do we feel it's like, what do we feel like? It's what would be good for them, for their development, like for their enrichment. Right? And, you know, because they were both employed, I mean, you know, we were fortunate we could go different places, right? And I just grew up with certain assumptions, right, that, you know, kids had childhood like that, right? But it's only later in life you realize that, you know, different kids are brought up with very different values in the family, right? So in part, what is right or what is good reflects our upbringing. It reflects culture, it reflects society. And the challenge with culture is it's not a stable entity, right? So 10 years ago, would I be thinking that we'd be having debates about bodily autonomy in the States and a woman's right to choose? No, I kind of thought we were past that in the United States. But here we are, right? I'm not sure how many of you were thinking that we'd be talking about tariffs a year ago, right? About whether I have to now shop like a good person and what does it mean when I, you know, is it a good thing to boo at a hockey game just on the grounds that, you know, the other country is the US now? Like, you know, we're dealing with different ethical questions, and what's being defined as being good or bad it changes over time, right? So you could say ethics is also a sociocultural phenomenon, right? It's something that is constantly shifting, right? We can't quite put our hand on it. What questions do you guys have about all of that? Is this landing there?
Would you say that overall, like, because I know you said that it's a cultural thing, but just in like human nature, would you say people are mostly ethical or unethical?
So I mean that's a great question, and you'll have different kind of moral philosophers answer that in different ways, right? I mean, some people would answer the question of, are people innately moral or ethical? They would say yes. Why? Because, you know, we grew up dependent on one another, right? Before we even, you know, take our first steps, right? We are literally dependent on another to meet our nutritional needs, right? So you could say we're brought up in a way whereby we are cared for, right? And so it's normalized, the normative sense is that you would care for others in response. So because of that dependency, we are ethical. On the other hand, you know, we do have a tendency to think of ourselves in groups, in tribes, right? You know, I need to think about my family. I need to think about my country first, right? Is that ethical if we have a tendency towards making divisions between ourselves and others, right? Who's in my tribe and who's a part, who's on my team compared to a part. So it's a complex question. I would say that ethics, what I'm trying to do here is to try and show and also help kind of explore with you what falls in that umbrella of the term ethics. And it's more than just what ought I to do in this situation. It actually relates to all these other matters that relate to how we are with one another. Is that satisfactory or okay?
Yeah. The reason I was asking is because you were saying like booing at a hockey game. I never even thought of that. I never thought about that technically being unethical.
Yeah.
And it's like just something that people do. If you're losing, if you're winning, even if it's your home team and you just like to boo with them. I never thought of that as like an ethical question. It was kind of, and this idea that there's a collective, there's a group of people who are deciding to make this decision.
Yeah. So what do you think? Was it the right thing that we booed the American anthem in the Four Nations face-off? Right? Was that a moment that we should be proud of as Canadians? And here we have foreigners in our country, and you know, we're drowning out their anthem with our boos. Would you have booed if you'd been there?
I can't say I wouldn't have, but only because I feel like if I was in the situation, like I said, I would have never thought of it as like unethical, you know what I mean? And then now that you mention that, that is, I'm not gonna lie, a little bit eye-opening, because that is true. It is, I guess, an ethical question. the fact that these people are not on their homeland, they're from America, and this is a national anthem, it's something that we should be paying a lot of respect to.
Yeah. So I mean, is it different? Would it have been, and maybe someone else, is it okay to boo someone else's anthem when they're not a guest? Right? So they were invited as a guest. What if we had been in the United States and we were their guests? Do things change as far as what's the good thing to do? What do you guys think? Was it okay to boo?
I don't think so. I mean, I can understand the context because of the type and so on, but I don't think so. Because I think that it's still a form of respect. I can understand the deal, like, I'm Italian, but it's, so it's even another thing. But I can understand the political deal right now, and US versus Canada, what is going on, and what Trump is doing. But doing such an act is like, I don't know, I don't see the point in doing that. And it's very disrespectful. And it's not about, like, I don't see why doing such a thing, even if it was not US. Like, if it was another team, it would have been the same. I don't see the meaning in doing such a thing in, like, but yeah.
So I'm not going to answer these questions for you, right, with my opinion, but I would say ethics as a discipline would try and open these kind of questions up to appreciate that there's complexity here to this question, right? Like, we didn't ask the question of, if you'd been watching the game from home on the TV, are you now okay to boo? Right? Knowing that maybe they won't hear it. What if you have a friend over who's American? Does that change things? Right? So, we're trying to, ethics as a discipline doesn't just deal with ethical questions, but it tries to open up and raise different questions, right? So raise questions that you may not otherwise ask, right? Now, for a number of contemporary philosophers and people in ethics, they would say that we live in a technological world. And really, it's a challenge to think of any human experiences nowadays that aren't mediated or touched in some way by either quite basic technologies or quite complicated ones. When you just look around the room here, right? I'm being filmed. Ugh. I'm being shown on YouTube. It always makes me uncomfortable, right? Which means what I'm saying, potentially someone else can watch and take out of context later on. It's shaping or affecting our interactions with one another. Right? It might shape whether you want to ask a question or whether you want to speak, right? Because the camera in some way changes things about how we relate to one another. How we're sitting around this table also changes things, right? The fact that I'm sitting here and you're all sitting there. I mean, if I were to stand up right now, that would also change things. It changes the way that we're related to one another. How I provided an introduction changed things, right? Here I am as the speaker, and who are you as the student? Everything from the tables around the room, the fact that we're in a closed space, a very high-pitched noise that you barely hear in the background, right? All these things affect how we relate to one another. And then there are, of course, also our different things, like our phones. Got you. Are you totally ever in one place when at a given moment, I got caught too, my kid texted to say, you pick me up after school, right? And so are you ever really just here when you're always connected to somewhere else? Right? So in many ways, the contemporary ethical question is, how do we understand intersections between ethics and technology? Or how do technologies change things in our relations with others? Okay. So contemporary philosophers of technology would tell us that often the most mundane and everyday technologies are encountered pre-reflectively. And I would also say often the most sophisticated technologies are encountered pre-reflectively. You know, in this moment, as these parents are reaching to touch their child, right, look at all of these things that are present. Right? The incubator, which sole purpose is to keep the baby warm, to keep their skin humid, because when you're born really early, you have really thin skin and you lose fluid. The incubator is actually a really fascinating technology because it really marked the beginning of neonatology. If you were going into the history of neonatology, you would see that as a profession, we didn't start out in hospitals. In fact, you could say we started out at the fair. So you look at the history of neonatology and you'll see pictures of little portable incubators taking little babies to fairs in the United States and showing them off as world's smallest baby. Right? So the impetus was to keep these babies alive, to show them off. Right? And in many ways, we still use incubators every day to show off the baby. Right? They're translucent, so we can look and see how they are without disturbing them. But they change things. For a mother who's just had a C-section, have any of you guys here had C-sections? I don't think you have. I haven't. Kim hasn't. It's not comfortable. I'm amazed at women every day, they have a C-section and yet within like hours, they're like, can you please like put me in a wheelchair and bring me to my child? And here they are trying to reach in while they're sore through this little hole just to touch their baby's hand or rest their hands on their hair. Right? So on the one hand, yes, it shows us the baby, but it shapes how we come in contact with them. Right? So that's when we start talking about the ethics of it. Well, some incubators, the new ones we got, you press a button and they lower all the way down. Right? They're accessible. Right? And you could say a good incubator doesn't just keep a baby warm. It doesn't just let you see them, but it also supports their family to touch them, to come in contact with them. But we only ask those ethical questions if we start to look beyond how was this thing originally designed, if that makes sense. But the point is we encounter these things pre-reflectively without thinking about them. And it's only after the fact that we reflect on them. Take a different example. I drove my car here today. And not a single moment did I pause to think of what is the experience like of driving a car to the hospital. Because it's such a routine and mundane thing. The moment I get in it, literally I'm embodying it. And it just changes the way I relate to the world. An important philosopher of technology is Don Heide, an American. Boo, I'm joking. And he's written a lot, right? This is one of his big books, Technology and Life World from Garden to Earth. And he takes what's called a post-phenomenological approach to technologies, which means for him, all human experience is mediated by technologies, but how technology mediates experience is different depending on the technology. For example, some technologies we embody are glasses, right? A cane, a bicycle, a car. When we so-called put these things on, it changes how the world presents itself to us, right? I hold a cane or a stick, I literally feel the world through the tip of the cane. I drive a car and suddenly 1 kilometer is a very short distance. Right? There are other technologies that we have a hermeneutic relationship with. They interpret the world for us. Right? So you know what, rather than going outside to figure out if it's warm or cold, we can just check our phone and it can say, it's 5 above. Why are we in a stuffy classroom, right? The point is, it's interpreting the world, and it's showing me an aspect of the world in generally a way that can be quantified or otherwise disclosed. Right? There are those that we have an alterity relation with. You know, hey Alexa, right? Play me a song, tell me a joke. What's the temperature like today? Hey ChatGPT, you know, what should I talk about to these students, right? On the topic of health ethics and technology, right? We encounter it as another. But then there are others that are situated in the background, right? Like the lighting, the furnaces, whatever is making this environment what it is. What's interesting though is that many technologies do more than one thing, right? So if we take the iPhone as a thing, we have so many different kinds of relations with it. Or take AI, which you're interested in. I'm sure you can tell me all the different ways that AI is now shaping our life, often in ways that we don't even realize, right? Like, you can't do a Google search right now without getting AI helping you know what to see. Right? You can't write a Microsoft Word or own an Apple product without AI giving you suggestions on your language and your speech. Right? So in many ways, it's in the background. But on the other hand, we also may embody it as a tool. We may encounter it as another. And it also may have a hermeneutic relation or disclose a hermeneutic relation. So these distinctions aren't so clear, but you can use them as heuristics to ask questions around a technology. Right? So how does whatever technology change my world? Right? So obvious examples from healthcare, a stethoscope, right? We embody it. Right? What happens when we embody a technology like a stethoscope? How does it change things? Well, by and large, a child becomes a heart to be heard. Right? So if I'm trying to listen to a baby's heart and I'm trying to hear if there's any heart murmurs or extra sounds or a gallop or something like that, for me it's just all about the baby being quiet. Right? I'm not looking in their eyes. I'm focusing on an aspect of them. Right? It's changing the way they're presented to me, which displays an ethics. A chest X-ray. This baby has congenital diaphragmatic hernia, right? Again, discloses this baby in a very different way than a stethoscope. It's hermeneutic if I know how to read it. We talked about things like the incubator in the background. But the important point for ethics is, regardless of what technology you're talking about, is that they affect our relations with one another. So if we can say, first and foremost, for an ethics of technology, or if we want to begin to understand the intersections of ethics and technology, that we need to ask, how do these things change things? A question that invariably comes to the surface at one point or another is it a good thing? Right? In the same way we were dwelling on the question of, is it a good thing to boo at a hockey national anthem? Well, the question is, how do you decide if it's a good thing or not?
So, to decide whether it's a good thing or bad thing, we should consider the other party, and they are are they hurt? Are we doing good or bad? And the overall outcome, not only our happiness, the happiness which is affiliated with all the parties. If everyone is happy, I think it's pretty much okay.
Can I push you a little bit? Is that okay?
Yeah.
Why?
Because when it, philosophically it says you can do good things and you can be happy, but if you are only happy, if you are the person who's only happy, but if the other one is hurt, that's not a good thing to do. So at the end of the case, everyone should be on the same page, and by your act, if you are the only person who's got the benefit or the happiness, it's not ethical.
Okay. Why?
because
We'll put
it's a
someone
moral-
else on the
moral
spot.
value to like.
Yeah. No, and I'm pushing you, and you could push me back the same way, right? So, you know, at the end of the day, like when you come up with an assertion of whether something's good or bad, right? How do you rationalize that, you know, the good thing to do is one where I don't hurt someone else? Like, why is that what's fundamental? Because what if I really, really want that thing, right? At what point is my happiness, you know, why can't I just do things that just, you know, maximize my own happiness? Why do I have to consider others? Right? Now, don't get me wrong, I think you're probably a very ethical person, right? But it's challenging because what ethics reveals, and people who study ethics, is that there's different ways of thinking about what is good and what is bad, different ways of rationalizing. But the challenge is at some point when you push your reasoning down far enough, you'll realize that there isn't really a ground to say why you should do one particular thing. So I'm going to show you, and then you can take a different position, okay? So these are kind of like the dominant ways of thinking about health ethics, about what is moral or what is good. One would be a deontological perspective. And I know this text is really heavy in words, but it's intentional because I'm sending it to you after. So someone who were to say, you know, the good thing to do is because there's a certain obligation or there's a certain principle or there's a certain rule out there that we all ought to conform to, would be said to be following a deontological perspective. So deontology is often known as obligation, duty, or rule-based ethics. Often people who you know, follow different kind of religions follow deontological ethical perspectives. So we see it in like the 10 Commandments: thou shalt not kill, honor thy father and thy mother. Please don't ask me to name them all. And you know whether you're doing the right thing or wrong thing, whether you're actually conforming to those commandments. Right? And in different faiths, there are different commandments. Now, the challenge becomes, you know, who gets to decide what are the principles we ought to all follow? Is it that society at large says it? Is it our government that says it? Is it that, you know, religious leaders say it, right? So along comes Immanuel Kant, and his famous first formulation, which essentially says, here are the rules that we should follow, and it is the categorical imperative, which means the fundamental rule, the fundamental principle that guides your action is, act only according to the maxim whereby you can at the same time will that it should become universal law. Right? So why should I, you know, be worried about the well-being, the happiness of others? Because I would want them to do the same for me. Right? Do unto others as you want done unto yourself. And that's how you justify or come up with, you know, which rules you ought to follow. Now, in health ethics, if you open up a book or you write like a medical school exam, they'll test you on the 4 cardinal principles of bioethics that all physicians are supposed to follow. And to be honest, most healthcare professionals incorporate these principles into their codes. Respect the autonomy of the patient, right? Which means don't subject them to controlling influences. Support them to become informed when they're making decisions, right? So you can't just ask someone, do you want to do this? You know, do this assignment next week. You have to first of all tell them about what it's about. Right? That's all part of respecting your autonomy, if that was a healthcare decision. Beneficence. All of our actions should do good. Non-maleficence. We should avoid harm. Sometimes we have to do harm to do good, right? That's the idea of proportionality, right? So, you know, I might have to make an incision in someone's chest, right? But that's the only way to perform heart surgery for them, right? So the benefit outweighs the harm. And the last principle was justice, right? Or the idea of fairness, right? So deontology is a very attractive idea for health ethics because people like something that you can write down and say, all right, here's the rules, here's the principles, let's all agree, let's all follow them. But it can also be really challenging because sometimes principles conflict with one another, right? When you say, gosh, I really want to respect this patient's autonomy, but they're making really dumb decisions. Or I think their decisions are not very well thought through and they're going to regret them later on, right? But my point here is not to tell you too much about deontology, but to start to appreciate that it's one way of making sense of what is good. Okay. So if we were to take a deontological approach to a technology, we would ask, what principles ought a technology follow in its design, right? So maybe for an AI technology, we would want the principle for it to follow to be transparent, right? We want to know what factors are being included in its predictive algorithm. Does that make sense? So this contrasts with a consequentialist perspective. So consequentialism takes the consequences of an act as the ultimate basis for a moral judgment. Right? At the end of the day, the right thing to do is the one that maximizes some end that we're all hoping to achieve. Right? Maybe that end that we're all hoping to achieve is the most happiness, right? Or the least people sad. In the COVID pandemic, it was very consequentialist. Save the most Alberta lives possible. Do you remember that? It's consequentialism. What is the best way to allocate vaccination? The way that saves the most lives possible, and lives and livelihoods. I can't believe I'm already forgetting it now. It's like just yesterday. Huh? But I'm hoping you can appreciate that consequentialism is different from principlism because it's looking at the end as the justification, or it's often referred to, not often referred to, the end justifies the means. It doesn't matter how you get there if in the end you've maximized the good. Now many people are very uncomfortable with consequentialism because it basically says anything goes if the end you're achieving is a good one. Does that make sense? So violate the patient's autonomy if ultimately what you're trying to do is save their life, and that's the most important thing.
So you used the example for the last slide about making an incision, and as long as the good outweighs the bad.
Yeah.
But then over here, you're saying that is that different, or is that still applying in this sense?
That's great. So the interesting thing about consequentialism, so a pure consequentialist would say that, the principle of autonomy, you don't really need to necessarily think about it, right? What you ultimately need to think about purely is the end. Now, principlism can incorporate principles which are consequentialist, right? So one principle could be a consequentialist articulation, like you need to maximize benefits over harms, but that still needs to be weighed against other principles. So, a pure consequentialist would probably say that, look, take whatever approach you need to save the most lives possible in the pandemic. If that means, that people who have medical complexity or otherwise are take more healthcare resources, don't invest in them, invest in everyone who's easy to save because you can save more lives with the same amount of resources. That's what you should do. But a principlist approach would probably have balancing principles, not just one that says you should try and weigh the positive against the good. But you know what, maybe another principle is people shouldn't be disadvantaged because of their, socioeconomic background, or they shouldn't be disadvantaged as a consequence of pre-existing illness, if that makes sense. But it's a good question, because in a way, there's overlap there. There's also character-based approaches to ethics, right? Here you say, what is good, or how we understand what is good or what is bad, is not the principles that supposedly guide the action. It's not the outcome that it's achieved. It's rather how someone acts in that experience or in that moment, and how their actions reflect virtues or good character. Right? So maybe something that's very virtuous in a healthcare provider is being compassionate. Right? It's not so much about principle, but being compassionate is realized through our actions, like, you know, how when we talk to someone, we choose our words, we sit down and we take time to talk, that we realize there's importances in silence as well, right? So a character-based approach can't help but ask different questions or look at a situation differently, right? So depending on the situation, it might lead us to a different action about how to act. Right? That's part of the interesting thing. Consequentialism, deontology, character-based approaches like virtue ethics, they might all take us in a different direction to say what is the right thing to do. Okay. Now, what's interesting, of course, is, this is supposed to be about technologies, not just about ethics. So we talked about principles informing technology design. But we can also ask, what ends should technologies achieve? And of course we can ask, how do technologies affect our ability to enact virtues? So, you know what, if a technology is in the room between a healthcare provider and a patient, and they're having to constantly look at it and type into it, right, to somehow fill out a patient history, maybe that changes the nature of communication in that setting. We might say, maybe that's not a great technology. Maybe scribe-based technologies inherently are good from a virtue perspective because it frees the healthcare provider from having to take notes, and they can focus purely on what's said. On the other hand, if you don't take notes or write stuff down, that also changes things, because many of us, when we take a note or write something down, it leads us to dwell or think about what someone said in a particular way, and it might lead to reflection. Right? So I'm hoping you're appreciating that there's possibilities for doing empirical research studies on how certain technologies might change the nature of healthcare provider encounters. Right? And of course, there was a large grant just awarded to someone at the U of A who was, I think, in rheumatology, designing technologies like a chatbot, which we have talked about chatbots before, that was more compassionate or understanding in responding to people's questions about rheumatologic disease. Right? So could you actually try and imbue virtuous characteristics into a technology? There's also communitarian perspectives to technologies. Now this is kind of more abstract and it's harder to put your finger on, and that's just the nature of communitarian ethics. So it's almost easier to show through examples, right? So have you ever had a situation where you were able to say, you know what, in the end, it didn't kind of turn out the way I wanted it, but I can kind of live with that story, or it kind of made sense. It just all held together. We sometimes talk about that in healthcare and narrative ethics, that there are some patient stories that we can talk about, others that it's really hard to share. And it's not necessarily because of the outcome, it's not necessarily because of some abstract principles, it's not even the virtues of all the characters, it's how everything held together in that moment, if that makes sense. That's narrative ethics, which kind of views what makes a situation good or not is how everything comes together. Narrative ethics looks at stories as like a heuristic or a sense-making activity. But there's also relational ethics that situates what's good in the context of how we relate to one another, right? which is different, right? I can think of situations, and of course I can't use specific patient information in a context like this, where I've had end-of-life conversations with families, or situations where we've talked about, you know, what's really valuable or what's really important to them in how they're gonna inform or make their decisions for their baby. And sometimes parents will talk about, you know, it's just really important for me to be a good mother, right? To be a good mom. And, you know, part of being a good mom is seeing things through. I had to give birth to my baby preterm because of my own health. And I want to continue to take care of them in the ICU, at least until they get to their due date, because I feel I owe that to them. It's not really just a virtue ethics way of looking at things. It's how everything holds together, if that makes sense. It's almost like diffused across. So that's starting to look at a situation more from a relational or a narrative perspective. There's also some really great feminist thinkers around ethics of care who've written about this. There's also contractualist perspectives of ethics. Right, this is easier to explain. So a pure contractualist, and you almost have to say things like that, like a pure consequentialist or a pure contractualist. A pure contractualist would say that there are no ethics. There's no such thing. We're confusing ourselves. But rather our ethics are things that we negotiate on a day-to-day basis by the agreements that we make with one another. If I tell you that, look, I promise I'm going to finish this lecture by 3:20 today, and I don't, well, I broke that. But we've defined what is good by that agreement we made with one another. So we see that in healthcare all the time when surgeons do informed consent conversations with patients about the surgery they're going to perform. And you're a good surgeon if you led up to what you said you were going to do. Does that make sense? And the last example I'll use are physiatry perspectives to health ethics. Physiatry almost comes from like the legal system, right? Where you can look at like past cases and essentially say, well, if it was right then, would it not be right now, right? So in the same way in the legal system, often they look at jurisprudence or case law, and they'll say, well, look, in a previous case that was similar to this, the judge ruled that so-and-so was guilty. What's different in this case compared to that previous one? So you're using what came before. Ideally, not just to say, well, we did that then, so it must be good now, but also to ask questions like, what's different here? What's different going on in that case compared to this case? Now, the challenge with physiatry is that what happened in the past isn't necessarily always a good thing, right? So just because we used to do something doesn't mean it was good then, if that makes sense. But it's certainly valuable to look at the past to inform the present and the future. So all of these different kind of approaches can be used to start to unpack or think about a technology. And philosophers of technology who concern themselves with ethics and morality would say ultimately we're not just designing things, meaning that things are not neutral in and of themselves, but rather they are imbued with morality. Now, not everyone agrees, but I would say the old-fashioned way of thinking, was that, look, technologies are just things. And ultimately, as human agents, we have complete autonomy from them. Right? So a statement that would exemplify that outlook in life would be, guns don't kill people, people kill people. The technology has nothing to do with it. Others would say that, look, there's something about the design of a firearm, right? Literally, it's called a firearm because when you pick it up, you embody it and your arm becomes a firing mechanism. So it changes the way we relate to the world. So you can't say that it's totally a neutral thing. And clearly some technologies have more effects on us than others. So this is Langdon Winner's bridge. That he wrote about, and he basically wrote about these bridges that were built by an architect named Moses in the States that were quite short, right, quite low. And as you can imagine, you'd be able to get under one of these bridges with a sports car. You could get under them with a I don't know, a punch buggy, but it might be hard to get under them with a double-decker bus or public transportation. Now, the story goes that these bridges were built over the parkways that would allow people to get down to the beach. And yeah, they were built so people could walk across and not get hit by a car. That's a good thing. But they were built intentionally low to the road to essentially limit people who depended on public transportation from using the beaches. Right? And they would say that this is a bad technology, right? Because it's discriminatory or embodies discrimination. So he uses it as a way of kind of illustrating, and it doesn't really matter whether Moses did this intentionally or not at the end of the day, but simply to say that technologies exert a moral effect. That makes sense. Now there's many different theorists who kind of work in this space of how is it that technologies and humans interact with one another. I talked about Don Idy already, who takes this questioning phenomenological approach of how is it that a technology shapes my experiencing of the world. But there are also people like Bruno Latour, and I'm hoping some of you who are in engineering fields have heard about things like actor network theory. And Bruno Latour would say that, look, when we think about technologies, we need to think about humans and technologies as being enmeshed with one another. We're bound up with one another. We're all actors within larger so-called programs, roles, and routines. Right? And in a way, both human and non-human actors are on some kind of equal ground. Right? We can do similar things. And he has different kinds of terms that he uses if you get into it, like composition, reverse blackboxing, program of action, and delegation. And here's the classic example. Bruno Latour's sleeping policeman. And essentially what he's saying here is that people have delegated to the speed bump, the policeman's action, right? To replace the policeman's action in this program, right? And that's why they are, you slow down. Why? Because you don't want to get caught, right? And depending on how you look at things, this is potentially a good thing, right? A good thing because it leads you to slow down in a community of, children at play, like a neighborhood park or something like that. Right? But the point is that we exist enmeshed with one another. So all of this is to say that all of our different kind of technologies, we need to look at them not just as far as what they are, but how they change things and how we interact with them, how they become a part of our living. For health ethics, or medical technologies, we ask, how do things change in the clinical environment? How do they change the nature of diagnosis or prognosis, right? These different predictive algorithms that are now coming into play with AI, for example. How do things get changed when we talk about AI scribes being used in clinical encounters? How do we think of technologies like AI being used to interpret radiology or X-ray or other kind of imaging, right? When they replace, healthcare providers potentially. And then we ultimately have to think about, as these things change things, how does it sit with us? Is it a good thing? Is it okay to boo at a hockey game? I made this slide some years ago, right? And it shows 4 different benches, right? A bench in New York, a bench in Tokyo, a bench in Montreal, and a bench in Edmonton. And I really liked this. One, because this bench is like from right near my house. 2, because they all express a certain morality, right? So what do they all share? They're all somewhere that anyone could sit. But how do they differ?
because the three pictures in New York, Tokyo, Montreal, I think it doesn't allow people to sleep.
Yeah.
That's why they are divided. But at Milton one, someone can sleep and
Yeah. So, you know, who are the users of these benches, right? So for the New York, the Tokyo, the Montreal bench, I mean, this is designed for the transit passenger, right? The person who comes and sits down and then goes up and leaves. But maybe the park bench in Edmonton is designed more openly, not just for the person who needs a moment to rest, but maybe also for someone who needs somewhere to sleep or lay down, which, you know, affects a certain morality, right? Who are these public spaces for? Who is part of the community? Who are we designing for? Those are ethical questions. Almost done, 3:15. So this is my last slide. So ethics exists as a discipline precisely because the rightness and rawness of our action cannot simply be reduced to reasoning or calculation. So I put you on the spot, which I'm sorry, it was a bad thing. Because this idea that at some point, you know, why is it that we should maximize the most happiness? Why is it that we should follow these particular principles compared to others? In many ways, it's because of, you know, our society, our culture, right? How we're brought up, like our own values of our family and the institutions in which we live. But those institutions also change. And as citizens in country, in Canada, in North America, in the world, you know, we are not passive. We have to potentially stand up. We have to potentially speak up if we're not liking the way that society is shifting. Okay? Because ethics is more than reasoning, right? Navigating ethical situations benefits from finding a fitting response to a situation at hand. So in healthcare, we didn't talk about this much. Often there is more than one way that one can act. And how we decide to act at the end of the day respects who we are responsible for, right? So often as healthcare providers, you know, there's more than one action that's appropriate, more than one treatment that's appropriate for a patient. But who's going to be affected the most? It's the patient, right? So who does the decision come down to? It comes down to them, and we support them in their decision. We try and find a fitting response to the situation at hand. It's important to recognize that a goal of a framework and ethical consultation and deliberation is to open up possible understandings. So this is the idea that we were talking about before. I hadn't thought of it that way. That's the value of ethics. And often when ethics gets consulted in clinical consultations, they're not coming to essentially say, what's the ethical thing to do? They're coming to help open up the situation and to bring more understanding to it. So hopefully all those people involved can come up with a solution, not that's necessarily a compromise, but one that's a fitting response. So, all of that to say, will you be kind enough for next Tuesday to choose one technology and prepare a 6-minute presentation? We're not going to time it. Actually, that's a lie, a total lie. I am going to time it. If you go over 10 minutes, then we'll start to say, we just want to make sure we have enough time for everyone. Right? That's the only reason. If you're done it in 3 minutes, that's totally fine. Right? Like, don't feel you have to use up all the time. We just want to make sure that everyone has a chance to present something, and that's an opportunity to have discussion. How does that sound, everyone? Okay. I'm seeing the audience, so we say it's okay. I'll send out these notes if they're helpful for you. My email is on the last slide. If you're stuck on the weekend, I'll check my email on the weekend. I'm more than happy to connect, okay? But it's not supposed to be a stressful thing. It's supposed to be for fun. Cool.
All right, great. Yeah, so I'll send you a Zoom link for next Tuesday. Yeah, cool. And you know, if somebody is ill or something on that day where it's not a forced march, you don't feel like getting out of bed, you still have to perform, that isn't the way it is, so, yeah. Okay, cool.
Thank you.
Thank you.
All right, that's it.